Welcome back at 7:14. When we think about cancer, oral, head, and neck cancer is not always top of mind, but it is more common than many people realize. And April is Oral, Head, and Neck Cancer Awareness Month, emphasizing early detection, education, and prevention. Dr. Earl Park, he's a maxillofacial surgeon and oral surgeon as well with LSU in Touro. He's with us this morning to break down the warning signs that you should not be ignoring anymore after our conversation this morning. Dr. Park, good morning. Thank you for being with us.
Hey, thanks so much.
So let's talk about why these types of cancers are something that people should be paying more attention to.
These are sneaky kinds of cancers, little ulcers in the mouth or little irritations. It's easy to brush these things off, but what we know about oral cancer is that early detection could lead to way better results, and it could even save your smile.
Let's talk about who's most at risk and how that has changed over time.
Well, by far the biggest red flag is people that smoke. But I've been talking to a lot of young people about vaping and nicotine pouches recently, which are also very dangerous. Heavy alcohol use is important risk factor as well.
And then vaping, of course, a whole nother issue with the youth. So that's another layer of warning to them about the risks of utilizing those products.
Yeah.
But the great news is, we talked about early detection is key. There are screenings for this, because sometimes you may not even really notice a sign or symptom as potential cancer, but screenings can pick up on those things. What kind of screenings are available these days?
Screening is really easy. You go into your doctor, your dentist's office, and they look into your mouth and feel your neck. It takes less than 2 minutes. There's no needles or cameras or expensive x-rays. It could be very quick.
So if you're going to your regular twice a year, dental checkups, you don't even realize it, but they're kind of keeping an eye on potential problem spots in your mouth. Is that right?
Absolutely are. Yep.
And what are they looking out for? You mentioned they could be so small. What could be something that they're seeing that you wouldn't even consider while you're brushing your teeth?
Yeah. So they're looking for little ulcers or red and white spots, lumps in the neck, or changes in your voice or swallowing.
And let's talk about early detection, how that can be such a game changer. Because again, these cancers, all cancers obviously deadly, but are these as deadly as some of the other cancers that people are more familiar with?
Early detection is so important. You could really change the outcome, and this is important in a city like New Orleans. It could save your ability to eat. Food is such an important part of our culture, so early detection is critical. If
people had to walk away with one piece of information or one key moment of our conversation today, what would you want that to be?
I think that something to keep in mind is listen to your body. If anything stays for more than 2 weeks, then it's important to get it checked out. Early detection is really impactful to the outcome, and with early detection, we'll keep everyone smiling and living their best life in New Orleans.
Dr. Park, we appreciate your time this morning. Some good reminders about cancers that, like you mentioned, people may not realize are a threat, but aren't so familiar with. We appreciate your time this morning.
Thank you so much.